The whole purpose of me doing this advocacy work was contingent on the idea that these things should not be shameful and people should be more aware. People should prioritize and validate female sexual pain and pleasure and function just like anything else, any other health condition. So I felt like if I continued to keep it to myself, I was not fully living in that truth for myself. Not everybody wants to and has to disclose anything. But for myself, that's what felt right for me.
Welcome to Life as a Patient Doctor. I'm your host, Dr. Stephanie Moss, navigating life as a patient and a medical doctor. Walk alongside me as I reflect on the challenges and triumphs and lessons I've learned undergoing medical education with invisible disabilities. Join me as I interview other doctors, students, and healthcare workers on their own journeys. Listen to their unique stories on how they balance their health while caring for others in the health profession. Welcome, everyone. Today, I'm very excited to interview Sarah Ponce, who's a queer Chicana third-year medical student at Keck School of Medicine at USC and is dedicated to revolutionizing sexual medicine research and practice. Her journey, fueled by a personal history of pelvic and vulvovaginal pain, has ignited a passion to advocate for marginalized communities and redefine healthcare standards. With an unwavering commitment to inclusivity and innovation, she aims to pave the way for compassionate and comprehensive care for all individuals, regardless of gender, background, or identity. Thank you so much for joining, Sarah.
Thank you, Stephanie. I'm happy to be here.
I would love to just hear a little bit about your background and journey into the field of medicine.
Yeah, definitely. So I always knew I loved science and problem solving growing up, and being a doctor just felt like a natural profession for me. I knew really nothing about it, but I do remember just thinking I wanted something in science that works with people. And then I also have a dad who was in the LEFD fire department. And so I grew up hearing his stories of responding to emergencies and just the needs of the LA community. And I thought that I wanted to do something similar, but with kind of a bigger scale or like more preventative or just more decision making. So I went into undergrad at University of Portland in Oregon, which is far enough, but not too far from my hometown in Southern California. I noticed that there weren't a lot of people in Portland who looked like me and my family. So I had this craving to get back to my roots and learn more about my family's history. My grandparents immigrated from Mexico in the 60s, and I didn't have a lot of experiences that they had. So I participated in some service immersion programs at my school, one at the Tucson border to do some service and distribution resources at the border, as well as a migrant farm worker immersion in Yakima, Washington. So I got to learn about sustainable farming practices and healthcare for migrant workers. And it really inspired me to continue pursuing medicine and continue to fight for accessible healthcare and health equity amongst underrepresented populations. So I thought I wanted to be a primary care physician, and that's what I thought up until the year right before medical school. It's funny because all of this history and coming from an immigrant background or immigrant family roots and growing up Catholic, I never thought that I would be a sexual health advocate in the end. I grew up with minimal sex education and sex positivity. I had a lot of fear tactic narratives around sex and intimacy. It meant letting someone else take advantage of me or my purity. There was a lot of shame to break down, but I had a exposure therapy for that when I dealt with my own pelvic and vulvovaginal pain. I had to really advocate for myself to get my diagnosis and eventually the right treatment. I had to break down the fear and shame and this belief that I didn't deserve pleasure or deserve to be pain-free. So that experience was the prelude to joining a community of other sex health advocates who've been through similar situations and are fighting to break down stigma and create more accessible healthcare for people with sexual pain or pelvic and vulvovaginal pain in their lives.
Thank you, Sarah, for sharing all that. I relate to that so much of being one from Hispanic and Mexican roots, and also the struggle of trying to get back to your roots and trying to figure out and going to a location that there isn't a lot of people that you. I'm excited to hear about these communities. I think that is how we originally met. So what type of
Yes.
communities of health providers that advocate for sexual health care?
After I got my diagnosis and treatment, my doctor introduced me to a few of his patients that gave permission to reach out to other patients with similar conditions, encourage them, and also just to offer any advice that they need. So I met people through that. And then some of them were also involved in this community called Tight Lipped. Tight Lipped is a nonprofit grassroots organization for and led by patients with pelvic and vulvovaginal pain. And we do advocacy around these conditions to increase accessibility, education, and comprehensive, compassionate care. Throughout that first year of recovery from my surgery that I had to treat my pelvic and vulvovaginal pain, I started being more involved peripherally. I would listen to the podcast, which is how the organization started, and I got involved in community events. It was important for my healing to just know that I was not alone in what I had experienced. And it gave me hope that I could someday be like those in the organization that use their experience to make a better world for other people like us. After I started medical school, I had a strong drive to teach my peers what I had learned about my own conditions and those affecting my fellow patient advocates in Tight Lipped. So I joined the urology student interest group and presented to them my idea about the inaugural Sexual Medicine Awareness Week at Keck School of Medicine. It was the first time Keck School of Medicine students would learn about pelvic and vulvovaginal pain conditions such as vulvudynia, lichen sclerosis, and different things that cause sexual dysfunction in females.
What was the response? I actually think I went to that one. What year was that event? I have a memory. So we do one at Rush in Chicago, and I think we also collaborated or went to the one at Keck. But yeah, I would love to hear when that was and what was the response from other students.
Yeah, so the first one was in 2021. It was the year I started medical school, and we had mostly in-person hybrid events. So it was in person, or you could have the option of attending via Zoom. And there were different lectures from sexual medicine experts like Dr. Erwin Goldstein and Dr. Alyssa Yee at San Diego Sexual Medicine, who gave an overview of the different conditions that can cause pelvic and vulvovaginal pain. There was a talk about medical gaslighting, a patient panel with people from Tight Lipped and others that I met through my doctor. And also, pelvic floor physical therapists came to discuss how to manage pelvic floor dysfunction causing sexual dysfunction, things like that, that were from a comprehensive biopsycho model that sexual medicine physicians like to use to address these conditions. Then we had it the second year in 2022, and that one was more Zoom based. And that one, we did have a collaborative event with the Medical Student Forum for Female Sexual Medicine, which is a conglomerate of Chicago schools coming together to put similar events on. And that was hosting Dr. Maria Uloko for a discussion on medical gaslighting and sexual pain. And the response from my peers was very positive. A lot of the events, students stayed after the event was over to ask questions, especially for the patient panel. A group of students stayed an hour later to continue asking the patients questions. And it just felt like such an invaluable time for them to learn from people who've experienced these delays in diagnosis, medical gaslighting, the havoc that these symptoms wreak on their function and quality of life. And there were some students who did come up to me or reach out to me after the events and shared with me that they were so grateful that I led this initiative because they suffer through conditions like this too. A couple of those students did end up joining me to continue these events at Keck School of Medicine, and we decided to form the Pelvic Wellness Collaborative at Keck School of Medicine. So that's where we are now. Unfortunately, there's no one at Urology SIG who is able to continue Sexual Medicine Awareness Week through the Urology Student Interest Group. But the Pelvic Wellness Collaborative has tried to keep these events going on Zoom, as well as extend to the LA community in a larger scale.
That's amazing. And I want to congratulate you on how you've been able to take your personal situation and also take the privilege of being a medical student and doing something about it, educating other students so we can all fight together, so we can help all the thousands and millions of people that are suffering. I also really appreciated the statement that you said of when you found that community, it gave you empowerment because and that's like the reason I do this podcast is to help people feel like they're not alone because it's so important for people to know that because in isolation, that's where we really struggle.
It can feel isolating, especially in the beginning, if you're still trying to form your community and find those groups where you can do this education or advocacy. It takes time to get to a place of healing from your own medical trauma and your own years of chronic pain to be able to talk about it. And it happened in stages for me. In the first Sexual Medicine Awareness Week, I did not come out as a patient. I was just somebody who had an interest in this and had connections to these patients somehow and brought them. But it wasn't until the second Sexual Medicine Awareness Week where I was able to share that I had the conditions that we were speaking about. And then this year when I'm more comfortably sharing publicly about my story.
I'm interested, what was the motivation to start to disclose? Because that is something that I receive a lot of questions on. Tell me a little bit more about that decision of whether or not to disclose. And obviously, right now, public and going into fourth year and all that entails.
Yeah, it always knew that I would eventually disclose because the whole purpose of me doing this advocacy work was contingent on the idea that these things should not be shameful and people should be more aware. People should prioritize and validate female sexual pain and pleasure and function just like anything else, any other health condition. So I felt like if I continued to keep it to myself, I was not fully living in that truth for myself. Not everybody wants to and has to disclose anything, but for myself, that's what felt right for me. And then going into fourth year, you're implying kind of the unwritten rules of medicine. And that's to be professional. It's very minimally humanistic. It's you're a worker, you are there to learn only. Don't get me wrong, I do consciously try to still fit those molds when I'm on rotations. There are times where I do speak up about what I believe is happening to a patient with pelvic and vulvovaginal pain because a lot of the doctors have yet to learn about some of the conditions. And so I do find that tight-lipped is where I have my voice. And sometimes it's hard to go through rotations and feel like the weight of the medical hierarchy is not allowing you to fully express yourself. Your focus is on the patient and not on your story. So tight-lipped gives me that avenue to feel like my voice is heard and that my desire to change the way things are is put to use. There's always a thought in the back of my mind that me disclosing could influence a residency program's willingness to take me as a resident. But I think I do have the privilege of showing that I have gotten treatment and I am better and that it does not influence my quality and function of life anymore, which is it's unfortunate. That's a privilege to have, but it is a protective factor for me. And there is some underlying fear that if you are unable to perhaps sit for long periods of time, maybe you will not be able to do your administrative tasks as easily, or if you're going to be calling out of work because of symptoms, then it might be difficult to maintain the necessary hours. On another topic related to residency, I do have this like niche interest in sexual medicine. And that doesn't mean that I am unaware of all of the other things that I might be interested in throughout my journey in medicine. I do want to be a urologist because I am passionate about genitourinary conditions in all genders. I'm open to discovering something else I might be interested in urology, but I know that right now going to pursue urology is the best field for me to be in to continue exploring questions about sexual medicine, sexual function, as well as urinary symptoms and different things that affect quality of life. When I'm talking about my experience, I also try to make it known that, yes, I have this very specific experience, but it has made me interested in other conditions that affect quality of life, other conditions that cause pain or urinary frequency or fecal incontinence, and just other things that allow for patients to be in a doctor patient relationship to make collaborative decisions about their next steps for management.
Thank you so much. I love that you said that of the quality of life focus. I think it is something so important in not just urology, in medicine to begin with. I think we spoke on this that Olivia, who is a previous third-year medical student podcast and you're friends with and know her through all our sexual health medicine connections. It's really cool that urology has that ability to focus on sexual health and really dive into it. I know when I was trying to decide my residency, I didn't choose urology, but I was between family medicine, psychiatry, and really trying to figure out which one can I really address sexual medicine and at what angle. So I like that a lot. And yeah, the fear of disclosure in residency, that is so real. That is so valid. I feel that a lot. Exactly how you were is going to be so helpful in the fact of empowerment, in fact of advocacy about your passions of why you do what you do. I think we skipped over, and did you want to talk about any challenges or triumphs besides all the amazing sexual medicine things that you did? Is there anything else you wanted to talk about?
Sure. So, some of the challenges that I faced that I think a lot of people in medical school can relate to is challenges with mental health. I've always had, for as long as I remember, depression and anxiety. I remember even as a little kid, I would have anxiety around making friends and different moments in my childhood where I remember that feeling. And then I've always gone to therapy ever since I was young for these symptoms, and it's always helped me. But then in medical school, these symptoms became more somatic, more visceral in the way that it impaired my function in day to day. So, and I don't whether this is due to constantly being busy or stress or not having time to do like your normal coping mechanisms, or even just the difficult things we have to face in clinical scenarios, whatever it was. It happens to a lot of medical students where their previous, like maybe mild mental health issues become a little bit bigger. So I faced a moment where I was skipping some days of school because I was overwhelmed by my anxiety, or I was often tearful with my depression. And then I was losing weight because of loss of appetite. So then I really decided I needed some help with medication. So I started an SSRI, and the first one I took actually caused panic attacks as a side effect. So I ended up having to postpone an exam to a later date because of the kind of time I had lost and focus that I didn't have. And then I tried a different medication, and that one works very well for me now. I'm very happy with it. I noticed anhedonia, feeling emotionally numb, and it affected kind of sexual function as well. So I added on bupropion, which is, if people are listening or in the health professions, they know that it's an additive sex positive medication. It adds dopamine and norepinephrine. So it also added more emotional life to me. So I'm on those now, and I have no shame about it. It's very common, and it hasn't been as isolating as my other conditions. So I'm very open about it. I feel very happy with where I am now, where I have the tools that have helped me focus and be more productive and balanced so that I can address bigger life issues and achieve bigger goals.
Amazing. Thank you so much for sharing that, being so vulnerable and open with your experience. And everything you said is so valid that so many of us struggle silently. And it's, like you said, so common that a lot of the health conditions, maybe that weren't as prevalent before, become more impactful when we have this huge stressor of medical school and everything. I definitely relate to that. A lot of my health conditions got worse. And something that you said was somatic. And I really want to clarify, because that word, a lot of people not in the health profession don't really know what that is. Do you want to clarify what you mean by impacted somatically?
Yeah, I don't mean like it was all in my head. I think that's something that people hear a lot with that word. I meant it's more something that I feel impact my body more often. So somatic, it can be like causing muscle tension. For me, it caused just feeling weak, feeling tired all the time, the loss of appetite. Those are very kind of corporal body function things that I experienced.
Exactly. That body mind connection is so important to clarify. It's one of my personal goals in my future medical profession is really to use that since I am trained in somatics with body mind connection and using movement. So I really like to make sure that people know about that connection. You already spoke a lot on breaking stereotypes. Do you want to talk about the benefit of having individuals with health conditions, that diversity perspective? Why is that a positive thing for the medical community?
When I think about diversity in my own experience, I do think about health conditions, but also background and socioeconomic status, ethnicity. But for the diverse health statuses of people in medicine, I'll speak to intersectionality. All of these are intersectional identities that people can have. As a queer woman, I had to interact with providers when I was seeking care, when I was discussing my vulvovaginal pain assumed I was having penile penetrative sex, or they focused on birth control, why I wasn't on birth control, and assumed genders of my partners. Was not always in a place to correct them, given that it was such a vulnerable condition and situation I was in. A lot of times I just worried that maybe they didn't know what they were doing because they perhaps never addressed sexual concerns relative to queer patients before. So I wasn't sure if they would be able to help me. I had also constant anxiety about STDs, STIs, which led to isolation. I also had self blame because I felt like I was never doing enough work with my vaginal dilators, which are tools to help with pelvic floor hypertonicity or tightness. So there's just like a lot of inner feelings and a big inner world that your patient comes to you with. So it's very important to be aware of the complex psychosocial dynamics around their condition that they're having. They're not just a condition and they're not just presenting with a symptom, they're presenting with their entire experience in all of the ways that their condition may impact their life or the way their life impacts their condition. I really encourage people to get to know the patient and know that even if they're talking about something that seems unrelated, ask them how it's relating to their condition or how they're coping with their condition. Be open minded to things that you may not know. If you don't know how to address sexual concerns in a queer patient, seek outside help, seek somebody who does have experience with this, ask for advice, read publications, and listen to podcasts by patients and their experiences. And then the same thing with their condition. If you don't know about their condition or their symptoms seem off of the normal schema you may have of what you think it might be, then you can also do the same and ask for help. So I remember asking one of my pelvic floor physical therapists after 3 years of failed treatment for what they thought was just tight pelvic floor muscles, if she thought it was a good idea I see a sexual medicine specialist to evaluate my pain further, because my pain was mostly at the entrance of my vulva and not deeper. So she humbly responded by saying she was not sure if this would work for me. She had patients who had sought this kind of care, but wasn't totally sure of the outcomes. But she was encouraging, and without making any assumptions or judgments, she simply shared what she knew and supported me in my decision. So I know that it may be hard to think that even after all of the years working in this grueling system of medical training that you still don't have all the information you need to help your patients. It is very helpful for your patient to practice this type of open-mindedness.
Wow, I want to be a provider like that. Those are really great tips for current medical students and just anyone in the health profession, that realization that we're not going to know everything. There are going to be patients that come in and have symptoms that we've never heard of, and we don't just push them aside. We keep learning. And I love that you said that, being open and seeking education. As
Absolutely.
we start to wrap up this episode, do you have any advice or pearls of wisdom for other health providers, specifically students who also have a disability or a health condition?
Yeah, you may resonate with this profession and this track of being a calling, which is a beautiful thing. and it can feel spiritual in a sense. And some people can resonate with that. And if you do, we also have a body, and our bodies are a vessel for us to learn the lessons our spirit is here to learn. That being said, take care of your body, listen to your body, let your body be a guide for you to know what to do next. Trust what's resonant with you and your body, and what feels right and what's uncomfortable and what scares you can guide you into something better. And I would say follow your own path. You don't need to follow a timeline that others tell you need to follow or else you won't make it. There's many ways to do medicine and to get to medical school or to get to the next thing. It's not always a straight linear path on the same timeline. I would say take any extra time you may need to get yourself well, to invest in your body so that you can continue to listen to it in a healthy and loving way. Also, if you're a first generation student, make sure you take the extra time to learn all the ways someone needs to gain experience and connections to be a doctor or whatever health profession you want to be in. Another point I want to make is if you have a health condition or a healthcare experience that was very impactful for you in your journey, you don't have to disclose it. You don't have to share it all over the world. But I would say take the lessons you learn from that experience and let them fuel you, because you will need fuel to continue to sustain a healthy relationship with medicine, and take care and be gentle with yourself.
What beautiful words of advice and wisdom. Thank you so much, Sarah. And I'm just going to quickly review all the amazing things you said just in a short bit for everyone. So you come all the way from, did I hear LA? Is that where home is? Okay, so came from LA with grandparents that immigrated from Mexico back in the 1960s, had a father who's a firefighter, and even though you're a first generation student, you kept going and you worked to become a doctor and you got into medical school. Just growing up in a Latinx environment and Catholic culture that doesn't talk about sexual medicine, doesn't talk about sexual health. And it wasn't until later on when you got to medical school and you found communities like Tight-Lip, like your students at your medical school, like the patients that your doctor recommended. That's where you start to feel more empowered with your own pain and how to do something about it, how to be a patient advocate, and how to advocate and educate the rest of the medical community about sexual health conditions and about how we can really break this cycle of pain that our patients face. You talked a lot about some great ways specifically that you have turned that advocacy into work. And you even talked about how that has motivated you into going into the specialty of urology and learning how to take care of all types of patients, male, female, everyone, no matter where they come from or what types of genitalia or anything, to help them. And I want to also mention you were very vulnerable in sharing the mental health struggles that a lot of us struggle with, and how that has not just impacted your studies, but also impacted your body. And it wasn't until you sought help and advocated for yourself that you were able to get the treatment that you deserve and you were able to get to be a better student and doctor. You ended up talking about some amazing ways how the intersectional identity that you have can provide a perspective to be a better healthcare provider, and how important it is to follow your calling. And last thing you said is follow your own path and listen to your body and take the time that you need, which I think we need to just elevate and say, because we don't do that in medicine.
Absolutely. Thank you so much for that encouraging summary.
Thank you. And I just want to thank everyone who listened in, who joined in today, whether they joined in just through listening to the podcast or visual podcast. You can also see the visual podcast on YouTube and Spotify. And I want to just thank everyone who came. I like to remind everyone that you're not alone if you're struggling. We all struggle in different ways at different points in our life. And I want to use this podcast to show that even healthcare providers, even doctors can struggle, and it's okay. They got through it. And I hope that can provide some motivation or some compassion that you can take care of yourselves and get through it. If you want to learn more about these types of health conditions, I'll make sure to link below Tight Lift, because they're a wonderful organization and I'm a part of it too. And I also have tons of other sexual health medicine with sexual health support groups and podcasts on my website, medpsychmoss.com, which I have separated sexual health conditions and pelvic pain conditions of all different resources. So I hope that helps you. And then if anyone would like to get in contact with Sarah, how can they best do that?
Yeah, I have an Instagram. It's Sarah Ponce Med. So my first and last name, MED.
Perfect, Sarah Ponce. I'll make sure to include that below. And thank you all so much for joining. You can contact me on all social medias at medpsychmoss and also on my website. Thank you for joining. Thank you, Sarah. Good luck on your journey in medicine.
Thank you so much, Stephanie.